Hello, I'm Dr. Sudit Ranade. I'm the Medical Officer of Health for the County of Lambton. And today I have with me a face and a voice that I think many of you will recognize, Sarnia's Dan Edwards. Welcome, Dan.
Hey, thank you. Hi.
How are you?
I'm doing all right. I'm doing good. Feeling well today.
Good. Dan, how has COVID-19 impacted your life?
It's different. It's definitely different. Even, someone like myself with a disability, I was at first, I live on my own, and I decided, like, when the whole thing broke out, I decided that the best thing for me was to move home to be with my family, because I'm gonna get stir crazy just being here by myself, and I'm not able to go do my groceries the same way as I used to, because the wait time and the wait lines and stuff, and I don't want to put myself at risk. So I figured, what, let's just move home. And having to restart and figure out and adjust to that routine, that's been a challenge on its own. And then with everything with the individuals in my house, right, so I'm not used to being around as many people, right? So it's taxing, but you figure it out, right? You learn to adapt, right? But it's definitely been an adjustment for sure.
So you seem like you're a very optimistic person. Are there things that have been surprisingly good or positive about this experience?
Oh, I've taken away some things already. I think we're on day 60 or something like that of this, and there's a lot of things that I've taken notice to, and definitely being thankful and understanding how privileged we are, right? Like understanding, especially even like things like the word essential means, right? You didn't realize, a lot of people didn't realize how essential grocery store workers are to your day to day, right? How invaluable my PSWs are. I spent about over a year living in the hospital, and I've always had an appreciation ever since for doctors and nurses, physiotherapists, dietitians, speech pathologists, all those people, right? So it's definitely more heightened now, like understanding how invaluable these people actually really are to our day to day. With my PSWs, and like one of the things that they've been doing, I've been getting calls from their office, and they've just been asking me what's my temperature today, right?
So they do screening.
Yeah, so they've been doing screenings, like daily screenings on me, and I've just been taking my temp just as a part of the screening, and I felt that's kept me at ease too, because knowing that they're taking these practices to this level, like this seriousness, makes me feel better about the PSWs they send to certain houses or certain places, right? And so it's beneficial to everybody knowing that, those are the precautions that, organizations are taking.
Do you have any questions for me about COVID-19?
Oh, yeah. So when's this thing going to be over? When are we going to get back to,
Of course you would ask that.
No, but a second wave of this coming has been something that people have talked about. Now, what would that look like in comparison to like the first wave, I guess, here in Sarnia? Like, what would the second wave look like?
We have no idea. Really? So some of the projections say that a second wave would be bigger than the first wave, because actually not enough people have been exposed for everybody to be immune. But the other possibility is that with really good surveillance systems, you could preview a second wave. Like, you would know that it was happening in places around you and have time to rebuild in the social distancing measures that helped stop the first one. And so if you can do that, then you might be able to effectively go through that. But the problem is that then you end up sort of going back and forth on all the restrictions, right? So this easing of restrictions is not going to be a one-way thing. It's going to be a two-way thing, where we're going to ease them. We're going to see how it goes. And then if it looks like the virus is peaking again or showing up in these different places, then you have to make decisions about whether or not to go back.
Okay. So people should get used to the idea that even if things start to get lifted, this is just as temporary. Like, this could easily go back to being more strict.
I think we have to get used to the idea that the restrictions are going to potentially come and go in waves over time as we try to respond to the disease until there's a really good treatment or until there's a really good vaccine.
How much longer do you think someone with a disability, like the restrictions when they start to get lifted, like how long would it take for me to then feel comfortable about going out?
Yeah, I mean, ultimately those things, Dan, become personal decisions, right? So everybody has their own kind of tolerance for different levels of risk. And some people, right, even if they might be perfectly safe to go out, are still going to feel like they shouldn't, and they need to do what's comfortable for them. And so I would say that to you too, right? Like you need to go with your own personal comfort. There are going to be spaces that are made available to you, right? Like as parks and other places open up, but it's really up to your comfort about when you go and take advantage of that. And some people are going to go faster than others, and that's okay. Some people are going to go because they just need to get out and they need to do stuff, and that's totally fair too, right? Like
absolutely. Like I'm like, although like I have, I'm paralyzed, but I do not spend like 8-9 hours in my place. I just don't. Like I'm out. I'm either at meetings. I'm either at schools. I'm either visiting friends. I'm visiting my mom. I'm just. I miss restaurants. I'm crazy. You know what I mean? Like these are the things, right? These are.
Yeah. It's the stuff. It's the stuff of our lives, right? How we go through the world and society.
I had met with my spinal cord doctor to talk about some of the things that I should be doing, and he just mentioned almost basically the same thing as an able-bodied person, right? Obviously, wash your hands, keep your distance. If I do have to go out, wear a mask. If you're someone that doesn't have, with a disability and you don't have access to a mask, like what's something that like you can do? Like what's something that like you should, if you have to leave?
Yeah, so, all of the evidence on masks is kind of unclear right now, and so that's why there really isn't a strong recommendation that people should be masking. The more important thing to do is to keep your distance from other people, so that if you go out, then try to keep that 2-meter distance from others, especially if you're going to have a conversation with them or that kind of thing. If you're just walking by someone and it happens to not be 2 meters, like that's really okay. That's not such a big deal, right? Where the 2 meters really comes into play is like, you're actually spending time with somebody and you want that to be safe, so you keep it 2 meters apart. But in general, if you're just out and about, you try to keep as much distance as possible. But I think the important thing is to not get too worried about like, what if 2 people have to go through a small space? You just, either you take turns or you do it quickly, and it's not going to be such a big deal. So that like, it's not a major thing. In fact, I think people like put a lot of attention on masks when really what they need to put attention on is like not being close to other people and not going out when you're sick. What are you seeing in terms of your view on the community's response to this whole thing? Do you think that everybody is banding together to work on this well, or do you think that things could be better?
I think like day 7, it was kind of chaotic. And I say like I don't pick that as a specific date. I just say that like earlier on, I felt like you go on Facebook, you go on Twitter, and you see the news, and certain headlines said this, and then people are throwing out misinformation, and I felt like it was basically just like kind of a scramble to see what is what, right? But as it's progressed, day 40, day 50, and today, I feel like I'm more at ease with the information that I'm getting and where I'm getting it from. Going to the Lambton Public Health website, like finding out what's going on here locally. It's just. Yes, it's unfortunate. It's terrible that people have lost lives to this, and businesses are closing down with the restrictions. Like that is absolutely awful. However, the information isn't there to scare you; it's to inform you. And so, by taking that, I'm able to see and just properly, assess the risk, right? Like when I go places, right? So I feel like it's gotten better. It was kind of just like a frenzy at the beginning. Like you didn't know what to believe. Like, there were certain things I had to stop watching, like CNN and, certain things and stuff, because like I'm getting information. I don't know what's going on. Right. So, but, sticking to the Lambton Public Health has definitely been the way to go, I feel, for people living around here.
That's good to know. Thank you. And what is the message that you would want to leave with the community in terms of helping us through COVID-19?
Definitely be thankful that that you're in the situation that you are right now. Although it's not what any of us thought this year would look like, be grateful for what you have. Understand that anything and everything is temporary. You know, good days, you know, cherish those because they don't last. Take comfort in the fact that bad days won't last forever as well, right? So those are just as temporary. So we're gonna get through this. We just got to be a little bit patient and yeah, just, you know, be grateful along the way.
I really appreciate that. Thank you. That's a great message.
Oh, I'm glad I was able to help out. So yeah, let me know anything else.
I will. Thanks again. It's super nice to meet you.
Absolutely. All right. Talk to you.
Take care.
Yeah.
Bye.
Bye-bye.